Welcome to our Mirror Healthy channel. I hope you will find this lesson helpful. Please like and subscribe for more lessons like this one. What are hemorrhoids? Hemorrhoids are when the veins or blood vessels in and around anus and lower rectum become swollen and irritated. This happens when there is extra pressure on these veins. Hemorrhoids can be either inside anus called internal hemorrhoid or under the skin around anus called external hemorrhoid. Who is at risk for hemorrhoids? Anyone can get hemorrhoids, but they're usually associated with eating diet low in fiber, spending a long time on the toilet, straining to pass stool, aging and deterioration of the muscles around or in rectal areas, overuse of laxatives or enemas, pregnant women's, obesity, anal intercourse, heavy lifting, pulling or pushing heavy materials, having a family history of hemorrhoids, having long-term or chronic constipation or diarrhea. What are the symptoms of hemorrhoids? Each person's symptoms may vary and it depends on the type of hemorrhoid. Internal hemorrhoids. Internal hemorrhoids lie inside the rectum. You usually can't see or feel them, and they rarely cause discomfort. But straining or irritation when passing stool can cause painless bleeding during bowel movements. You might notice small amounts of bright red blood on your toilet tissue or in the toilet. A hemorrhoid to push through the anal opening, called a prolapsed or protruding hemorrhoid. This may result in pain and irritation. External hemorrhoids. These are under the skin around the anus. Symptoms might include itching or irritation in the anal region, pain or discomfort, swelling around the anus, bleeding. Always rectal bleeding is not due to hemorrhoids, especially if you have changes in bowel habits or if your stools change in color or consistency. Rectal bleeding can happen with other diseases, including colorectal cancer and anal cancer. How are hemorrhoids treated? Treatment plans involving lifestyle changes, medications, or medical procedures. 1. Lifestyle changes. Many people get relief with home treatments and lifestyle changes. The main goal of treatment is to reducing symptoms. This may be done by consuming high-fiber diet. Adding more fiber to your diet means eating more fruits, vegetables, and whole grains. Adding more fiber to your diet can improve constipation and help you strain less when defecating. It also works by increasing the amount of water in the stool, making the stool softer, easier to pass. Bowel work well and prevents constipation. As a result, you get less irritation of the veins in the anus and rectum, and then the hemorrhoids heal. Psyllium seed, metamucil, and methylcellulose, citracel, are significantly decreases bleeding and pain. Psyllium is mainly used as a viscous, soluble dietary fiber that is not absorbed by the small intestine. The purely mechanical action of psyllium mucilage is to absorb excess water while stimulating normal bowel elimination. The laxative properties of psyllium are attributed to the fiber. It absorbs water and subsequently softens the stool. Soak regularly in a warm bath or sitz bath. Soak your anal area in plain warm water for 10 to 15 minutes 2 or 3 times a day. It relieves pain, itching, and discomfort in your perineal region. Soaking this area in warm water relaxes your anal sphincter, which helps increase blood flow through your anal tissues. This promotes healing and reduces the pain, itching, and irritation felt due to various health conditions. Epsom salts. It contains magnesium and sulfate, which, when absorbed into the skin around the anus, can offer relief from hemorrhoids by reducing inflammation and speeding up the healing process. Epsom salts are usually used in a sitz bath by dissolving the salts in the water. Using ice packs to reduce swelling. The swelling and irritation associated with hemorrhoids can be reduced by applying ice packs or a cold compress to the anal region. 2. Medication. Common types of medications used at home treatments include stool softener, example docusate sodium. It is used softens bowel movements and avoids straining while sitting on toilet. Bulk-forming laxatives and fiber supplements, example methylcellulose, metamucil, psyllium and wheat dextrin. These types of medications used to prevent hard dry stools which make hemorrhoids worse, reduce bleeding and other hemorrhoid symptoms. Pain relief, example pramoxine rectal foam, ointment, or wipes are used to relieve pain and itching. Steroid cream, hydrocortisone rectal cream is used to reduces swelling and pain caused by hemorrhoids. Do not use for longer than a week and do not use at all if you are pregnant. Medicines to shrink hemorrhoids, example phenylephrine ointment. Do not use over-the-counter treatments for more than 1 week without speaking to your doctor. They can damage your skin. 3. Medical procedures. If you have persistent hemorrhoids or they recur often, you may need more intensive medical treatments. These include rubber band ligation. This is non-surgical procedure. It used to cut off circulation to the hemorrhoid. The hemorrhoid shrinks and goes away in a few days. Sclerotherapy. A chemical solution injected around the blood vessel to shrink the hemorrhoid. Electrical coagulation. A special device uses a beam of infrared light to burn hemorrhoid tissue. Hemorrhoidectomy, surgical removal. This is a more invasive hemorrhoid treatment and is only advised when other interventions fail. Surgery is effective and usually prevents hemorrhoids from returning. Thank you for watching.